Have you ever had a broken bone, a severe sprain or strain, or even a torn ligament or tendon? If you have, then you have probably experienced wearing a cast. There are two main types of casts. There are plaster cast and the fiberglass cast. The main cast that you normally see is the fiberglass cast. These are identified by the cast with the colors on the outside. A cast helps your body to heal by immobilizing the injured part. Applying and removing the cast, maintenance of the cast, and the amount of time a person has to wear the cast are three important parts of the casting process. To apply the cast, the doctor will first specify the type and location of the cast. I am going to be giving an explanation of how to apply the fiberglass cast. When the doctor decides where to put the cast and what type, whether it be on the arm, a thumb spica, short arm, long leg, depending on the injury, the skin is first protected by what is called a stockinette. This is a thin piece of fabric that is placed directly under the skin to help protect the skin. Second, the thin layer of soft padding is applied. This adds some extra padding to the injured part. After the padding has been applied, the fiberglass roll will be applied. The casting material is rolled like a bandage over the soft padding. The fiberglass will start to get warm and will harden. This will ensure you that the cast is set. After the injured part has healed, the cast will be removed. This is done with a special cast saw. The cast saw vibrates back and forth. It does not go in a circular motion. This helps to prevent the skin from being cut. Maintaining the cast can be a challenge, especially for kids. Cast should not get wet. The padding underneath will hurt the skin if it remains wet, and it can begin to start to smell and cause an infection. When a patient that's wearing a cast wants to bathe or shower, it is important to wrap the cast first in a towel, followed by a plastic bag, and using some duct tape to seal off the ends of the bag. If the cast happens to get wet, it is important to get it dried immediately so that it does not hurt the skin. The best way to do this is by using a hair blow dryer on the cool setting. Never put anything in the cast to itch it or for any other reason. This can bunch up the padding and be harmful to the skin. The amount of time a patient has to wear a cast depends on the injury and the doctor. Some injuries can heal in a couple of weeks, others can take up to a few months. Other things to remember when wearing a cast is make sure you are able to wiggle your fingers or toes depending on if the cast is on your arm or leg, and to watch for any signs of infection, which can include foul odor, fever, pain, or drainage from under the cast. Casts are important in the healing of some injuries, but it is important to take care of them to ensure that you heal properly and do not cause any other damage to yourself.